Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. And today with us is Dr. Wesley Shankland of Lima Dental Associates. So, welcome back.
Thank you, George. It's always nice to see you.
Well, same here, sir.
Thank you. Neil, last week we talked about why.
Yes.
And there's several whys we ask at Lima Dental Associates. And today I'm going to say, why would I need a root canal? Now, I know we all remember that movie with Dustin Hoffman and Marathon Man. But let's talk about comfortable root canals.
Good.
A root canal is used to take out the diseased nerve of the tooth if the tooth becomes infected. We can save the tooth the rest of the person's life, or at least for a long time. But connecting this with our show last week, you need a crown on that tooth. So we take the nerve of the tooth out, and the tooth can die because there's a deep cavity. You know, a lot of times, George, somebody will go to the dental office and the hygienist or the dentist will say, you've got a filling here, a cavity we have to fix. But the person, for any number of reasons, procrastinates. I understand that. The problem is that filling continues to grow and get deeper and deeper. And all of a sudden, now the patient's sensitive to hot and cold temperatures. They may have...
It's infected.
It's infected. They may have swelling below the tooth. They may have swelling out into the face, which is quite dangerous. It can actually cut off the air supply. We have to hospitalize people sometimes for that.
Ooh.
So when your dentist says you need a filling here, you know, try to listen to what he or she says, because that could stop you from having to have a root canal in the future. Root canals are used to save teeth. We go in, take out the diseased nerve. We put a special filling inside the tooth. But once you have the root canal finished, you need a crown, because if you don't, the tooth becomes fragile and it can fracture.
So you do need both of them, actually.
That's right.
Okay.
So if you have a filling, or I'm sorry, if you have a root canal, you have to have a crown placed on it, but you can save that tooth. And that's important because you never know if a 25-year-old, for example, has to have a root canal. We never know at 45 or 50 if he or she is going to need that tooth to help a bridge or a partial, or just have a tooth to chew with. So it's important, if the dentist says you have an infection, your tooth's sensitive to hot and cold, get a root canal. You can save it with a crown on the tooth.
Okay. And there's a painless way to get that all done.
Oh, absolutely. We get the infection out with an antibiotic, and then we treat it painlessly. It is painless if you do it that way.
Okay, very good. You're full of good advice and answers.
Well,
here,
I don't know, but next week we're going to talk about some more whys, and we've got two or a couple more to come here.
Good, thanks, Wes. That's our report for today. Dr. Wesley Shankland from Lima Dental Associates.